So now we're going to go over the normal operation of the instrument. This is very critical to get this down, as unlike most laboratory equipment, this is very dependent on the user. So we want to make sure that we can get consistent results and accurate results as much as possible. So the way we do that is we're going to use what's called the 3-beep method. So when this opens up, you're going to hear a beep, and then in 20 more seconds, you'll hear a second beep, and every 20 seconds, it'll give a beep. So what we want to do is we want to have it so that we introduce a sample the same third beep every time. So when we're ready to begin running, what we want to do is we want to calibrate first. So this instrument, when it's calibrated, it is calibrated according to the temperature that is in right now. So we want to make sure that it is equilibrated and it is there for at least half an hour. And you want to make sure that you don't have any temperature swings. As we talked earlier, we don't want any open windows or vents or high foot traffic, because all those will make your results fluctuate. So when we can be sure that it's been rested for at least half an hour, we're going to open up our calibrator. So when I start, you always start with the 290. Never start with 100 or the 1000. You always start at 290. So I don't know why they programmed it to start in the middle one, but you start in the middle one. So we're going to take the 290, we're going to break it open and dispose of that sharps according to your lab's workflow. And when we're ready, we're going to open the chamber. And what that's going to do, it's going to introduce our sample cup right there. So with that sample cup there, that is now ready for a sample. So when it sat there for half an hour, that TC wire was being held closed in a controlled environment with this sample cup. So it sat there nice in that nice controlled environment. Now we just open it up. So now that sample or that TC wire is now in a completely different temperature than it was before. So that temperature is changing, and this thermometer it detects changes as low as 0.00031 degrees Celsius. So very, very, very sensitive. So I want to make sure that I am controlling as many variables as I can. So with this open, it's ready for a sample. First thing I'm going to do is I'm going to put in a sample disc. Now, it's important you only get one sample disc. If I run it one time with one sample disc and next time with two, I'm going to get different results. If I spill these sample discs on the table and I pick them up with my hands, the oils in my hands, they're going to give me different results. So I want to make sure that I keep that. Again, I'm trying to limit all the environmental factors. So when I'm ready, I'm going to get a pipette tip, load up this 10 microliters, and we have this little notch in here for your pipetter to go. So we're going to sit here, and I'm going to wait for a beep. So dispense, tap, and hit close. So this first one, I'm going to just ignore the results. I don't really care what they are, because what I want to do is I want to get that instrument used to being open for 1 minute. That's 3 beeps, and then close it. And then the next time I want to have it open for 1 minute, which is 3 beeps, and then close it. So as I'm running, I am getting this instrument to give me the same consistent results every time. So when this opens, I'm going to take a lint-free wipe, and I'm going to wipe out that sample cup. I'm going to clean it out. So I remove the sample disc, clean it, throw my Kim wipe away, and then I'm ready to introduce the next one. So the next one, I'm going to I'm going to put a new disc in, aspirate, and I'm going to sit here and wait. And then on that third beep, I'm going to dispense, tap, close. I got to do that same timing every time to get consistent results. So it's 297. Like I said earlier, I'm not worried about that one. So there's one beep that was already heard. So the next thing I'm going to do is get a disc, place a disc in there. That was my second beep. Dispense, tap, close. So if I did that dispense tap close on the third beep, then this is now the standard that I want this to run with. So I'm going to do that one more time, and I should get the same result, this sampling, and then with my third one, I should be in that same range. If I'm getting 295 each time, then I'm going to say, okay, that is where my calibration is now based on the ambient temperature. And so then I would hit calibrate after that. Once I hit calibrate, I'd move to the 1000, and then I'll do the 100. Okay, so that one came in at 291. It's close to the 290 that I expect. So there's one beep that already went. I'm going to put in my next sample disk. There's two beeps. You want to make sure your sample disk is, see down at the bottom? If it's up on the side, there's a chance it's going to hit your TC wire. And then you're going to contaminate it and have to clean it. So when this one is completed, if it is within 2 or 3 of the 291 that I just had, then I'm going to say my instrument is running well, my instrument is repeatable, I'm running as good as I possibly can, I'm not introducing extra factors to it, so then I'm going to hit calibrate. What I don't want to do is if I hit calibrate on something and I have not warmed up the instrument, or I messed it up, or I used the wrong standard, the wrong calibrator, or whatever, the instrument is going to trust you as a user that you know what you're doing. So if you hit calibrate and it's saying this is 290, but it's really something totally different, it's going to shift your calibration curve and it's going to shift all of your QC results. $292, which is very close to what I just had, so I'm going to hit calibrate. So it says, okay, it's going to consider that now is my 290. So now I'm going to hurry and open my 1000. I'm going to repeat the same process. That's my second beep. And third beep. So again, I dispense, tap, and when you tap, that seats that sample disk at the bottom, and then hit close. Do the same every time. So this instrument is really created and designed to be used as kind of a batch analyzer. It's not really designed to be as a random access. So ideally, you'd want to have all your samples ready at the beginning so that you would calibrate, and so every minute, every third beep, so every 20 seconds is a beep. So every 60 seconds, you would introduce another calibrator, then you go to your first sample, your second sample, or QC or whatever you need, and you're always doing them at that third beep. If you have it sitting and you ran your stuff in the morning and then you go to lunch, you go to your coffee, whatever, and you come back to use it, now we've got to get it back up to the same timing. So at that point, you'd want to start over, and I would run, you can run DI water, you can run just some extra serum, to run whatever you can just to get the instrument back to the same timing, to having it open and being exposed to the outside air and then closed, and open for 1 minute and then closed. And that's why you're going to get your most accurate results. So if this 1000 comes in close to 1000, then I'm going to hit calibrate. If it's off a little bit, I'm going to run it one more time just to make sure it's not something that I messed up. If I'm running and I know I messed up, I was a little fast, a little slow, the sample disk wasn't all the way, or maybe I feel like I might have short sampled, then I'm going to not use that. So this came out at 1002. So that's very close. I think we're good. We're going to hit calibrate. Get the old one out. Wipe out the sample chamber. And now we're going to do the 100. So that was my second beep. And third beep. So after this 100, it's actually going to come up, and it's when I hit calibrate after the 100, it'll tell me my contamination level. If the contamination level is above 10, the manual says to do the automated clean. I personally, if it's more than 5, I'll do the automated clean. I want to get that as low as 0 or as close to 0 as I possibly can. 1 or 2 is great. And keep in mind, when I'm retrieving my sample disc, never use your tweezers to get the sample disc. I've seen customers where they'll use that and they'll dig and they'll take out the coating of that sample disc, and then it's worthless. Then you got to buy a new sample disc. So always use something soft, like your lint-free cloth. So I came out at 95. I'm going to do that one more time just to make sure it's not something that I messed up on. I don't think I did. But if this comes out at 95 again, then I'm confident that I got the same result. It was just my previous calibration that was a little bit off. That was my second beep. And third beep. So once you have calibrated all 3 levels, then you are ready to run your samples or QC, whatever your lab's procedure is. We'd recommend using QC. It comes with some of those QC samples. I'm just going to run one of my calibrators as an unknown, as kind of a QC sample, just to make sure that when I calibrate it, it's calibrated where I need it to be. So 93. So I'm going to assume that that's very close to where I had before with my 95. So I'm going to hit calibrate. And it says my contamination level is 0. So it's really good. My TC head is nice and clean. So now I just had 1 beep, and now is when I would start running my QC or samples. So just to double check that everything's good, I'm going to run my 290 again. It doesn't really matter. You can pick whatever one you want. That's my second beep. And third beep. One thing to note is these controls in the glass vials, as they're used and as they're open, they're going to start to evaporate. And as they evaporate, it's going to obviously concentrate the salts that are in there. So you're going to have higher and higher results. So usually they're good for about half an hour to an hour, but longer than that, you're going to start seeing your results start to climb. So you want to make sure you open new ones after that. So my 290 came out at 289 when I ran it as an unknown. So I'm happy with that. I'm right where I want to be. So now's where I would start running my patients if I had them, or whatever, QC, whatever you need. And again, doing them all at the same time is the best way to use this instrument. When you're done, after you ran everything, you can go ahead and just hit close. Now the instrument doesn't know that I didn't put a sample disc and more sample on there. So it's going to sit and try to read it, but it's going to eventually find out that there's nothing on there, and so it'll just go back to normal mode and leave the door closed, and then you're ready. You can go to whatever you need to. When I come back to use it again, I don't know if the temperature around it has changed. I don't know what has happened differently. So I want to at least run my QC to make sure I'm still in line. If my QC is out, then I want to recalibrate. And again, the first one I do, I want to run just anything through it. It can be DI water, it can be serum, patient sample, whatever. And I'm going to just throw away that first result knowing that it's not going to be very accurate. So as long as you do that, then this instrument should give you very accurate results, very precise results.